One day, like many others, I was in the community hospital in Jaltenango in Chiapas, where I was collaborating as a pediatrician with the organization Partners in Health. It was a very hot day, one of those days when you just wish to be under a fan, drinking cold water, when a newborn entered to our emergency room. From the moment I saw her, I could see her little bones through her skin due to the severe malnutrition she was experiencing. You didn't need to be a medical profession to realize the difficulty she had in breathing and how hard it was for her to stay awake. Her mother and father explained to me that her overall condition had worsened in the past few days. She had stopped eating and she had difficulty breathing from the past few days. However, they couldn't bring her before because they lacked money and transportation for the 4-hour journey through the rough mountains. Neither of them could read or write, they lacked official Mexican documents, and they had 7 other children waiting at home. When I examined the baby, she showed signs of severe dehydration, malnutrition, and a septic shock. I knew she needed intensive management with antibiotics, intravenous rehydration, parenteral nutrition, and mechanical ventilation. But unfortunately, we didn't have many of these in our hospital. And even with all of this, the chances of her survival were very low at this point. We could only find a small vein to administer some fluids, antibiotics, and oxygen to help with her difficulty breathing. But after 24 hours of providing her with the best care we could with the limited resources we had, she wasn't responding to our treatment. So then I had to have the conversation that no doctor wishes for, and that said the words that never stop hurting. There is not much more we can do. She's not responding to her treatment. From the beginning, the family expressed to us their refusal to transfer her to another hospital because their social and economic situation was very complex. And after thinking it for a while, her trembling father, with a broken voice, said words that I will never forget. He said, "Thank you for doing everything within your power, but if your medicine can't save her, let me fight for her in my own way." So he decided to take her out of the hospital and take her to a traditional healer. He said that maybe he could perform a miracle, and if not, at least he would know that he had fought for her daughter in his own way, and that she would die in peace because that's what God wanted. I couldn't understand what this meant, and at that moment I felt so powerless. I was certain that if she had had access to a doctor from the beginning, the outcome of the story would not have been the same. So I started asking myself, what is happening with all the other newborns that are arriving in the same situations as her? Why is there such poor access to healthcare in this region? Why do some have to suffer disproportionately when facing illnesses, especially newborns, children facing life-limiting conditions such as cancer, neurological illnesses, and disabilities? So I felt an immense desire to understand what was happening in this region of Chiapas, and I decided to initiate a research with my team to understand the root of the problem. So I organized with my team, and we began searching for answers through stories and experiences of the women in the communities. They share with us how challenging it is to seek for neonatal care. There's so many social determinants of health that act as barriers when accessing healthcare, and how in many instances it's even impossible to take this attention. And sadly, the results, most of the findings we saw reflected the significant healthcare inequities and the negative impact this can have on such vulnerable populations. So with a heavy heart, I filled myself with energy and began to dream and plan how to do and what to do to close the gaps we were encountering with my team. So together with them, we developed a project to improve the quality of care delivered to newborns in the communities in Chiapas where I work in, through specific plans and actions to work on. And I truly believe that we could make a positive impact in these communities. Everything seemed to be falling into place, and I felt like we were progressing together, when suddenly circumstances changed. After so many months of planning, invested energy, and teamwork, I found myself in a very difficult situation where external circumstances, such as a significant increase in the violence and insecurity in the region, were compromising my mental health. Have you heard how people say that doctors are the worst patients? Well, sadly, that's true. We struggle so much to pay attention to ourselves and our well-being, and most of the time, we put ourselves in the background. But in the end, although it wasn't easy at all, and after much thought, for the first time, I decided to listen to my inner self and took the decision of leaving the role I was playing at that moment. But after taking that decision, I questioned myself over and over again if that was the correct choice. What was going to happen with the project, and more importantly, with the people in the community? Was I failing as a doctor? Was I failing as a leader? I knew that staying physically there was not an option for me at that moment. But I genuinely wanted to remain connected and continue contributing with this project. I searched for ways to stay engaged and collaborate from a distance, but it became increasingly challenging to be present without being physically there. So I decided to take a pause and embrace some silence. And in one of those moments of silence, a little voice came into my mind, repeating words that we all heard from the first day of this program and that we repeat almost every Tuesday. Leadership is accepting responsibility for enabling others to achieve shared purpose in the face of uncertainty. It is a practice, not a position. So now these words made much more sense to me. And with them in mind, I decided to approach the elephant from another perspective. So after much contemplation, analysis, and more thinking, I gathered with my team. And I actually found out that one of them had genuine interest in continuing with this project, taking part of it and being the leader of this project. It wasn't easy to take a step back, but at the end, I decided to delegate, trusting her, be present, and support her in the way she needed to. On this journey, I continue to tread. I've learned many things. During the moments when I dream big and envision countless plans, when I'm in the field connecting with people and listening to their stories, when I get disheartened because things didn't go as I expected, and when I fill myself with energy and fire again to keep on fighting for a more just and equitable healthcare system. I've learned that just as in leadership, life is fleeting and uncertain, and it is filled with ambiguity and situations beyond our control, and that we must learn to sit with the discomfort of constant change and of not being in control of everything. We need to not force ourselves to change the situation, but instead simply observe them with curiosity and compassion, trusting the process and be open and receptive. Accept that there will be many occasions where we must delegate and trust others and let go, and that will be okay. And as one of you once said, it doesn't really matter what we are doing. We have to accept that we're just seeds and may not see the fruits often, but we've planted something on the path that someone else may see grow someday. So there is much need and work to be done in the world. So it doesn't really matter which path we choose. If the one thing we are doing it with passion and real commitment. I've understood that in every place and every job that I do, I can practice, share, and spread this way of doing things. And that in fact, it is possible to change the way medicine is practiced, despite what the entire system may say. It is possible to offer humanized quality healthcare from a comprehensive perspective, even in the most vulnerable places. I realized that the disparities and inequities affecting healthcare have a direct impact not only on an individual's health, but on the health of entire communities, and that we are also part of these communities. And so it's not about them, but it's about us all. And I have to say that this year has been the most enriching in my professional and personal growth. Thank you to all of you for being part of this journey, for being your authentic selves, and for sharing your dreams and your ideas and the ways you transform them into actions. Thank you for seeking strategies to provide healthcare in the most human way possible, even in times of war and environmental crisis. For raising your voice and advocate for those who cannot speak loudly. for fighting for the inclusion of the LGBTQ+ community, for addressing illnesses from another perspective of art and love, and for daring to change the justice system from within. For every hard work you do and that you do for and with the communities, and for putting them first. So I just want to say that let's not forget what we have shared and experienced this year. And let's always remember that being a leader not only implies innovating, creating, conveying, and guiding, but it is also a philosophy of being our authentic selves, being present, active listening, building trust in human relationships, and sharing actions for a collective good greater than ourselves. Thank you.